All right, let's talk about the entourage effect and what that word means and understanding the actual principles of the entourage effect. It's something that we see in a lot of areas, but we've never really given it that name before until cannabis came along, and we call the entourage effect from using a cannabis product. We'll learn what that means as we go through this lesson. But researchers are always looking for what's the active ingredient of a herb or a plant, because there's a couple of reasons for that. First of all, they want to be able to study something. So studying a whole plant is hard to pinpoint what exactly is working, what ingredient or chemical in that plant is having a physiological effect or the medicinal effect in the body. But the other thing is you can't patent a plant, a whole plant. You can't patent it, so you have to change it in some way or extract a part of it to make a drug out of or a supplement out of, and then that can be patented so you can have some more profit from it if it's been patented. So the reality is that nature all works together. We're all whole beings. Food is all whole. I'll often ask students, what is the active ingredient of an apple? And I'll get comments back like the vitamin C or the fiber, or the natural sugars that are in it. Are those the active ingredients? Well, really the active ingredient of an apple is an apple, right? Eating the whole thing is where you're getting the most benefit. We can take vitamin C on its own. We can take pectin as a soluble fiber on its own. But if we eat those two within the apple and everything that nature has put into that apple, we're going to have benefits from that apple that we don't even know about. It just happens through nature. So that's what we're talking about when we're talking about the entourage effect is that using all the different bits and parts that make up a plant or make up a food, we can have them all separately, but they actually work better when we have them together. So the entourage effect of cannabis just basically refers to the concept that all the constituents, or the cannabinoids, the terpenes, all the little chemical bits that go into making this plant, they all work together to create a more powerful effect than if we just had CBD by itself, or we just had THC by itself, or we just had one of the terpenes by itself. So it's kind of using that whole plant or more holistic method of using things. There definitely are times when we want just a single constituent out of the cannabis plant, as we might with other medicines or supplements as well. And those have very specific areas. But there's also a specific area where we want the whole plant so that we can take advantage of that entourage effect. So this was a theory from Raphael Mechoulam, who's the Israeli chemist. He kind of came up with this early theory about the entourage effect. So I'll just read a quote here. In 1998, Professor Raphael Mechoulam and Shimon ben Shabbat postulated that the endocannabinoid system demonstrated an entourage effect in which a variety of inactive metabolites and closely related molecules markedly increase the activity of the primary endogenous cannabinoids, anandamide and 2-arachidonyl glycerol. They also postulated that this helped to explain how botanical drugs were often more efficacious than their isolated components. So this is where we get into the areas of some herbal medicines or botanical supplements might do a better job than a single ingredient pharmaceutical drug. Now, there's definitely a place for single ingredient pharmaceutical drugs. Don't get me wrong on that. They have a very important place in our healthcare system. But sometimes some people might need the whole thing. So, we can also think of it as eating whole food. So if you look at white flour or white rice, versus brown rice or a whole flour, where you have nothing has been stripped out of it. We always laugh about the white flour because they pull all of the husk off of the outside of that wheat kernel, but that's where all your B vitamins are. And then what they do is they add back in synthetic B vitamins to make an enriched flour. So they're basically stripping out about, I'm just making up some numbers here, they're going to strip out about 25 or 30 sort of vitamins and minerals out of the husk of that kernel of wheat, and then they're going to add back in 8 or 10. So we actually end up with an inferior product. Now, of course, there's places where whole wheat flour just doesn't make a nice product like white flour does. But that's what we're talking about, the entourage effect. We can find it in cannabis, but we also find it in food as well and in other areas of life. So it's really about synergy. The entourage effect is about synergy. The interaction or cooperation of two or more organizations, substances, or other agents to produce a combined effect that is greater than the sum of their separate effects. So when things work together, we can have a greater effect than individually. Ethan Russo, who is an American, probably one of the top American cannabinoid researchers right now. You can find a lot of his material online. He's very good at, or very generous with his research work that he does. And here's what he has to say about the entourage effect. Although the single molecule synthesis remains the dominant model for pharmaceutical development, the concept of botanical synergy has been amply demonstrated contemporaneously, invoking the pharmaceutical contributions of minor cannabinoids and cannabis terpenoids to the plant's overall pharmacological effect. So he's basically saying, hey, we get a better effect when we use the whole plant medicine rather than just its individual constituent parts. So an interesting thing when it comes to cannabis and the entourage effect is that each strain or cultivar has its own ratio of cannabinoids and terpenes. And so this helps to explain, well, everyone has a slightly different effect to a certain cultivar. You get different effects from different cultivars, and so we can use different cultivars to treat different health effects or as medicine in the body. So again, it makes choosing your product a little more difficult because you have to sort of try a bunch of different ones until you find that they work. But it's going to be, you're going to have a better effect or a bigger effect, more medicinal effect, than just using individual ingredients. We don't have a lot of double-blind placebo trials on the entourage effect, but we do have a lot of what's called anecdotal examples. So that's basically where you have a lot of people are saying, hey, I had this effect from this. Then we can say it's anecdotal. It hasn't been proven in a lab or in a study, a pharmaceutical study. But if you have enough people saying, hey, this is what happens to me when I take this product, we can say that that's pretty good anecdotal evidence. So here's just a few examples from medical cannabis users. CBD is an effective anti-inflammatory, but its anti-inflammatory effects may not be enough for effective pain relief. But when we add just a little bit of THC in, it becomes much more effective. So we have people who might be taking a very high CBD and they come for a 3-month follow-up back at the clinic and they're saying, it's kind of working, but it's not working great. And we say, you know what, get this THC product that's fairly high potency. And when you take your CBD product, take 1 or 2 drops of the THC, write it down so you know what you did, so you remember what you've done, and see if that works a little bit better. And usually they can find the right ratio for themselves just by adding a little bit of THC in there. For additive effectiveness, cannabis products are best ingested with a fatty food. So the CBD, THC, and fatty food actually work together. So here's an example of where using 2 different ingredients, so a fatty food, so an oil, some peanut butter, something like that, some cheese, along with your cannabis product, especially an oral product, so something that you're eating that has THC or CBD in it. When we combine those 2, we have much better and quicker effects from it. If someone takes a cannabis oil, either CBD or THC oil, on an empty stomach and they never eat any fatty food with that, it will either be super slow to kick in, it will never kick in, or it will wait to kick in for your next meal. So if you took a THC product, an oil product to help you sleep at night, but you took it on an empty stomach and you didn't put any food with that, it may still be around in your stomach when you eat breakfast the next morning. And if you have a little bit of bacon or some butter on your toast or your muffin or cream in your coffee, it's going to kick in your THC oil from the night before. And that's not when you want your sleepy time medicine to kick in. So that's another example of kind of the entourage effect, is different products working together. There's also some studies out there and some anecdotal evidence of saying that people where we want these cannabinoids to get into the brain, it has to cross that blood-brain barrier, which can be difficult for some substances to get past that. When we take them together, the cannabinoids increase the membrane permeability. So that's when we're using a whole plant product versus just individual THC or just CBD by itself. So those are just a few examples, anecdotal examples. Some clinical examples where we've actually had some studies done. Here's one in a randomized controlled trial of oral mucosal cannabis-based extract. So that's where someone would put a cannabis product into their mouth, and it absorbs through the mucosal area in their mouth. So a lot of people would like put it under their tongue, and that gets absorbed directly into the bloodstream. Patients with intractable pain, despite optimized opioid treatment, a THC predominant extract failed to demarcate favorably from placebo. So that's basically saying someone who uses a lot of opioids, but those opioids are not getting rid of their pain, and they take something that is just THC, it still doesn't get rid of the pain. When they take THC and CBD together, statistically, they have a better outcome with that. So adding that CBD and THC together seems to give better outcomes for these people than just THC by itself. Another example in animal studies of analgesia, so that's studies of painkillers, pure CBD products produces a biphasic dose response curve such that smaller doses reduce pain up until a certain amount, after which increases are ineffective. So even you can take a whole bunch more and you're not going to get any more relief. Interestingly, the application of a full spectrum cannabis extract with equivalent doses of CBD and THC, that will eliminate that biphasic response in favor of a linear response curve, so that it doesn't matter how much is taken, you're still going to get that analgesic effect. And another one, a recent study of several human breast cancer cell lines in culture and implanted tumors. So this would be animal studies as well as studies within, a petri dish or just in the lab. This demonstrated superiority of a cannabis extract treatment to pure THC by itself. Some of these early THC pharmaceuticals that were out are pure, highly concentrated THC, and they find that they actually can be quite detrimental to health, where if we're using an unpurified or just a plant extract, we get much better results from that. And the theory is that that's from this entourage effect. That nature knows much better than we do why things were put together, how they were, and we just don't know enough to understand how all those different pieces are working together within the body. Here's quite a timely CBD and COVID-19, a virus pandemic that happened in 2020. CBD. They did a clinical study on this. So what's happened with some of the COVID-19 infections is we get this thing called a cytokine storm. And that's where the body is basically an uncontrolled release of cytokines, which is basically uncontrolled immune system. So the immune system basically starts freaking out and goes on overload. And that actually can cause a lot of excessive inflammation, swelling, pain, and it can even lead to a lot of death as well. So overproduction of the cytokines causes the immune system to basically not just attack the virus or the bacteria, but also healthy tissue as well. And this is actually one of the reasons why people got so sick from the COVID-19 and possibly died. So corticosteroids are the current treatment for calming down these cytokine storms. So, that's just the hospital version of what happens is just automatically corticosteroids, and they work somewhat. But there's some early results from an ongoing study that was done in 2020 looking at the efficacy of using CBD to calm down that cytokine storm. And the results of the study are really interesting. So it suggests that CBD alone does provide some relief, but if we combined CBD with some terpenes, it was much more effective than either than CBD by itself or the CBD with the corticosteroid treatment as well. So this study uses, it's a study out of Israel, and it uses a proprietary terpene formula. So they're not telling us what terpenes are in there, but there is 30 terpenes. Remember that terpenes are those aromatic properties that we find in all plants and cannabis as well. So 30 terpenes that are known for their anti-inflammatory effect combined with the CBD is what the treatment was. So the in vitro study, so in vitro means it's not in humans yet, so it's still just in a test tube, kind of. They tested this proprietary formula, which they've called NT-VRL. So that's the proprietary terpene formula. We don't know what those terpenes are that are in there. So they tested that, they tested the CBD, they tested the CBD with the terpenes, and then they tested the corticosteroid on its own. So CBD alone inhibited the cytokine storm by about 75%. That's pretty amazing. When you combine the terpenes, the cytokine storm was inhibited by 80%. So we did get an extra 5% increase with just the terpenes alone. When we combine the CBD and the terpenes, we get 90%. So that's a great efficacy to have 90% reduction in that cytokine storm. That's pretty amazing, actually. Where the corticosteroid only works by inhibiting about 30% of those cytokines. So we get a 3-time better result with the terpenes and the CBD than we do with the conventional treatment right now. So, of course, this study is ongoing and it needs to move into human trials as well. But this is a really great example of the entourage effect, where we're looking at a couple of products working together better than single products on their own. And we've put some references in there if you wanted to keep up to date on that research as that moves along as well. So that's the entourage effect.